Welcome to the Tarrant County Medical Minute podcast.
Hi, my name is Dr. Omar Selod. I'm your past Tarrant County Medical Society president. I'm honored to be joined today by our current 2025 Tarrant County Medical Society president, Dr. Triwanna Fisher-Wikoff. How are you? Thank you for joining us.
Oh, thank y'all for having me. I'm excited to be here.
Yes, we're excited. So you're our new president, and so how about let's have the audience kind of get to know you a little bit. Where are you from? Where did you go to medical school? Where did you do your residency? Talk on that a bit.
Okay. Well, I'm a local girl, so I was born and raised in Dallas. Yes, on the other side, but of the airport, but born in Dallas. Went to Duncanville High, so go Panthers.
Oh, wow.
Yeah. Did my undergraduate at Xavier University in Louisiana. Then I came back here for medical school at Texas Tech Health Science Center. The first few years for my clinicals in Lubbock, and then, my basic training was in Lubbock with the clinicals in El Paso. And then I decided to come back to Fort Worth to do my residency at John Peter Smith Hospital in the family medicine department.
Wow. I mean, and that is one heck of a residency.
Yes.
I mean, I tell all of the students and everybody, if they're looking to do family medicine, I can't think of a better place to train than JPS. There's no internal medicine residency over there, so you are front line of everything, correct?
Correct. We're the ones that are doing the admissions. We're the ones doing your surgeries, your traumas, the ICU, the pediatrics, sports medicine, geriatrics. We get a well-rounded education, and anytime I get a chance to talk to residents and even medical students considering family medicine, I say JPS is where you need to punch your ticket.
Yeah, no, absolutely agree with you there. All right, so how long have you been in practice for now?
So I finished my training in 2008. I did a short stint with Baylor down in Midlothian, right when I was fresh and green. And then I decided after a year to come back to JPS, and I served as a staff physician there for 3 years. Oddly enough, that's actually where I met my husband, the other Dr. Wikoff. And after 3 years in Byng County, ready to sprout my wings again in private practice, I joined Texas Healthcare, which is now Privia Medical Group of North Texas, and I've been with this group for 11 years now.
Excellent. So you trained in Fort Worth, loved it so much, decided to come back here, set your roots, your family, raising a family here. How many people are in your office group right now?
Currently in my office, there's 6 doctors, 6 providers, 5 doctors, 1 nurse practitioner. That's in my current office. For Privia Medical Group as a whole, there's over 200 doctors and another 200 APP.
Right, and a multi-specialty
Very
group.
big multi-specialty group.
So one thing that I'm pretty excited about, I've talked to a lot of people about this, is your presidency, I think, is a hallmark one and actually means a lot to a lot of physicians. And you are our first African American president of our medical society. And, trust me, it means a lot to a lot of physicians in the past, current physicians, and even our young doctors in training. So how does that make you feel? What responsibility do you feel in being the first?
Honestly, it felt very daunting
Right.
when I first learned about being the first African American president. Because I would have thought, this is 2025. You'd think we would have had more representation by now. But I consider it a great honor just to even get to this point. Just a little bit about where I come from and my going back even to my parents. I'm a first-generation college student.
Wow.
Both of my parents grew up in Jim Crow South. They never went to college. My mother went to trade school. My dad joined the Air Force right at the height of Vietnam. So for them to be able to make it where they did this far was an accomplishment for them. And I know they wanted the best for me and my brother. And I said, you know what? I want more, and I appreciate all of the love and support that not only did my parents showed me, but my ancestors and everyone who had fought to get to this point in equality. To me, I felt like you know what? I owe this to them.
Wow.
I think it's time, because there's a lot that not only African American physicians, but anyone of whether you're underrepresented minority or not, there's a lot that we can offer. I'm just given the opportunity.
Right.
And when Brian approached me a few years ago about stepping up into leadership, I said, why? First I said, why me? And he was like, well, why not you? You know, you've shown interest in our medical society. You come to the meetings. You've done extra leadership training. And he goes, just in talking to you, it's time. And I do want to say that it wasn't because of being a minority. This was, you're a leader, first and foremost. And you're the leader that we need to take our medical society to the next level. And so I'm very grateful I got that opportunity. Yeah. And I'm hoping this platform will give me an opportunity to tell our medical students, even our pre-medical students, our residents, even our practicing physicians, saying, you know what, I want to be part of what you're a part of. I want to be able to help our population, and I'm glad you're stepping up into this role so that now I feel like I can step up as well.
Right. No, I mean, that's a good point, because first of all, I can't imagine how proud your parents are. Are you the first physician?
First physician.
In the family? Yes. And what made you want to do medicine?
Oh, I loved the sciences. Even as a small child growing up, I loved life. I loved biology. I loved dissecting. I loved seeing how things worked. I loved seeing how things grow. And what better way than to culture your love of sciences than with medicine? And so it just naturally appealed to me. And so I took more science courses, got honors in biology and anatomy and physiology in high school. Another reason why I particularly chose is a University of Louisiana, because it has the reputation for the number one place for African Americans to go to medical school.
Wow, I did not know that.
Yep.
Wow. Okay, so you go to medical school, do your residency, you're come back to Fort Worth, you're practicing. What brought you into the medical society? Were you ever, exposed to organized medicine in your younger years of training in med school and residency, or how did you know to get involved?
I got involved very early on, just signing up as a student member at Texas Tech to the TMA. I remember when tort reform was a big deal and it was passed, and knowing what all of these physicians had gone through to going to the Capitol, trying to get laws on the books to make it possible where our malpractice can stay low so we can practice medicine
the way we want to practice medicine for our patients. Yeah.
And so that just always stuck with me. It wasn't until later, even though I kept the dues up and, paid my dues, it wasn't until probably a few years into practice, I think I showed up for a CME meeting because, we need to get our CME, and got used this as my firsthand exposure to Tarrant County Medical Society. Attended the meeting and said, wow, this is great. I want to be part of it. Took me a while to find the meetings.
Right.
But I showed up, and sometimes that's all it takes is just showing up and falling in love.
Yeah, no, that's so true because, you and I have been involved with the Medical Society for a bit, and you and I are in meetings frequently together. Same for me. Like I've realized that, I was a bit intimidated, in all honesty, about getting involved initially in the Medical Society in my younger years. I thought, they speak above my head, all this legislature talk and this and that. I don't know what they're talking about. I don't understand politics that well and whatnot. But once you come to a Medical Society event, and even more so a meeting, like the monthly meetings we have over here, you quickly realize, wow, I want to be part of this team, and I need to do my part. And that's kind of what drew me in. And all it takes is coming to one of the meetings. We have so many meetings that you can attend, but once you come to one, you just feel like, I want to be part of this. Yep. They're fighting for me and my patients and whatnot. So now you're president. You've got a year here. You've got to do articles in the magazine, which every past president has told me, it's not so easy to write. So I'm more than happy to have passed that on to you. I've done my time there. What do you plan to bring this year to our medical society? I mean, what's your agenda? You've got a busy year. If you could speak on that.
Yeah. Yeah, we're going into a legislative session this year. So we're talking about, going down to Austin for First Tuesdays, right. Which is the first Tuesdays of February, March, and April. There's a lot on the legislative agenda that...
And before you go any further, First Tuesdays, for our listeners, that's open for physicians, medical students, alliance members, spouses.
Correct, yeah.
Okay. First Tuesdays, you were saying.
Oh, okay. Yeah, so as Tarrant County, myself, and hopefully a whole slew of our fellow listeners and viewers will be heading down to Austin to meet with our policymakers, the staff, just to give them our perspective as what we feel is important for us to continue to practice medicine, make sure that that our patients are staying safe, making sure that public health still stays at the forefront, and also making sure that we have practice viability.
Right. Yeah. I mean, it's funny in today's world now, I feel like we really have to fight for our profession and to allow us to practice, our knowledge and our expertise on patients. All of a sudden, everybody's now an expert. Everybody understands vaccines, science. Mm-hmm. Do you have to even be a physician to practice, which of course you do. But scope of practice is important. Mm-hmm. Our medical society is very involved in, fighting for our rights on that. We had Dr. Kenton Murthy on our last podcast last year, who spoke to the about all the work they do with the public health department. Mm-hmm. And I mean, it's just a weird time, I feel. I don't know how you feel. Like, wait a minute, no, we are physicians, we are trained, we do follow science, but we're still having to fight daily for ourselves and our patients.
Correct. I mean, we're trying to make sure that the patient-physician relationship stays sanctified.
Right.
We want to make sure that we're continuing to do the best for our patient, provide the best evidence-based medicine possible for our patients, to ensure that health and viability of our county, our state, our country. And that's some of the things that we're going to tackle. You mentioned scope of practice, but also prior authorization, health insurance reform. All of those things are going to be very important to tackle this year, actually, because it seems like an uphill battle just dealing with prior authorizations, In fact, I'm going to head back to the office right now and work on more of those.
That's why we're in a legislative year, and you're on the front line. You're a primary care physician. I'm a specialist, but you have to deal with so many issues, just to try to get your patient care, prior authorization, referral, educating, dealing with the insurance company. So I think you're suited great for this legislative session. You can bring a wealth of knowledge. You've practiced for many years. But yeah, it's a burden, I would imagine, on your office, and it just gets costlier and costlier, which makes practicing medicine more difficult.
It does, especially in the primary care setting, because as you know, expenses are going up, but our reimbursements are going down, and that makes it really difficult for primary care doctors like myself to stay in practice. And it seems like we have so many obstacles against us. I said, just trying to get better reimbursement rates, which hopefully we'll get some bills passed in Congress to help with that, so that our practices can stay viable.
Do you feel, I get asked this, as you know, I deal with a lot of medical students, residents. What do you feel about burnout for primary care physicians? I get asked that a lot. Is it a big burnout field? I know my field. How do you feel it is on your end?
Well, in family medicine and primary care, so internal medicine, pediatrics, even OB-GYN, we're experiencing a huge amount of burnout right now. I think they quoted now up to, depending on which study you read, anywhere from 46 to 52% of primary care doctors are burnt out. I would not be surprised if that continues to increase, and we're going to see more and more of our fellow PCPs leave the profession.
So can you speak on scope of practice and its impact on your field in primary care?
Oh, yes. As far as scope of practice in primary care, as we were saying that, we're seeing probably an increasing percentage of our fellow primary care physicians getting burned out. One of the things that's kind of leading to that is this idea of scope of practice creep into, especially in primary care, from nurse practitioners, PAs, and other APPs who, healthcare systems and even some of these large independent groups, see as a cheaper provider option. Correct. Thank you. And if that's the case, if you're looking at short-term gain, then an actual primary care doctor doesn't seem like a good investment. So I know a lot of doctors, including myself, who are in the primary care world, tend to worry about that. But that being said, as a primary care doctor, I absolutely love my job. Actually, I shouldn't even call it a job. I love my calling. I love my career. I love my my specialty choice. I mean, because where else can, in 1 minute, I'm congratulating someone who lost 5 pounds in the last month, on weight management, who stuck it out with diet and exercise, congratulating him, giving him high fives, to the next minute, the next patient, feeling down, depressed, needing to get the help they need, and you can provide it.
Right.
And I said, my patients run from the gambit of age 12 years to 94, and most of those are within the same family.
Yeah.
So it's very rewarding. I don't see myself giving it up anytime soon, because we're all humans. And the great thing about being a primary care doctor is I get to take care of the entire person, the entire human, and the entire family. And it's multi-generational. I can ensure that the next, for that particular patient, that they can live on to become contribute to society, help their children contribute to society, heck, even have them have more children of their own, which I was fortunate enough to do. It's the best calling anyone could ask for.
Yeah, you all are definitely the quarterback of the team, and the play runs through you all, and you see that. I think we all can look back and with our parents or us, the primary care physician is just that one physician you can rely on and count on. And you're right, they take care of. My dad's primary care physician became my primary care physician because he took such good care of my father. And I was like, of course I'm going to go see him, right? Like you can pass it, as you say, generation to generation. You build these bonds with families. It's incredible. And, but listening to you speak gets me kind of fired up because like scope of practice and all the things that we have to work together and fight for. I mean, even more reason why we've all got to come together. And that's what's the beauty of the medical society. Our Tarrant County Medical Society is trying to unite us. We have more, a stronger voice if we're united. And I think, sometimes unfortunately us physicians as a whole, I'm not saying anybody in particular, we don't come across as a united front as we could. Correct. And I think this First Tuesdays and, getting involved with your local medical society helps to, unite us all. So hopefully, and we were talking before we started filming, one of the things that you're interested in doing is meeting with some big groups maybe in town that are not part of the medical society, correct?
Absolutely, yes. Because we're so... One thing I definitely want to grow this year is not only the number of members, but I also want to increase the type of members that we have. You've done an excellent job this last year bringing medical students and bringing in residents, and I'm going to piggyback on that.
No,
and
we'll do it together.
One.
We'll do it together. They're already bugging me about when's the next pickleball tournament, so we're going to keep that going. We will do that together. Yes.
But I want us to be more than that. I want it to be more than feeling like it's just the big health groups in town. I want it to be more than just the THRs, the Baylors, the Medical City, the JPS. I want to call on every independent provider out there, whether you're a little what we call onesie twosie solo practice to our big groups like Privia and Catalyst, and even our specialty groups like Fort Worth Heart and Consultant Cardiology. Yeah. I know PM&R for Fort Worth. You're already taking the mantle for that. Yeah. TDDC, I want us to bring all of these groups in to say that, you know what, your voice is heard too. Yeah. You're a physician just like us, and we need you.
We all need each other.
We need each other.
Irrelevant of your specialty, we all need each other. And what's the one place where we all, get together as one? And that's here at Tarrant County Medical Society. And I think our leadership, our non-physician leadership, is amazing in this group. Brian's great to work with. Yeah. I mean, everybody over here really helps pull us together. And I think sometimes they just, if a physician just give us a chance, just come to a meeting like we said, join the medical society. So that's great. Yeah. And I know all of us are happy to support you in any way because I think that will make us stronger if we can do that. And that would be a great thing to add to the society. Yeah,
because I mean we're all in this together. As cliche as it sounds, it really is. It doesn't matter if you're solo or big group, primary care versus specialists. There really shouldn't be any divide because we all want the same thing. We all want to take excellent care of our patients, and we all want our practices to thrive and survive. So it doesn't matter on what spectrum of the specialist primary care world, whether you're academic, employed, independent, we all want the same thing. And the one place to come and get that and help and make sure that we stay viable as a profession is the Tarrant County Medical Society.
Right. Yeah. I'm always so, I've said this before, I'm always so just, in awe of like, we have physicians that are retired. There's no more financial skin in the game like there is for you and I that are still practicing, that come to our meetings, that go down to Austin, that are advocates for physicians and patients. And that's the great thing, right? We have young docs in training to retired physicians. We're all united. But I just love how our, physicians that are retired continue to, the love of medicine, the love of the field is just, inspiring, I find. So, yeah, I think we could all get together, and I'm excited for your year as president. And I think you're a great leader. I think you're going to have a wonderful year. We're all here to support you, applaud you. It's a lot of fun having just sat there. I actually, before I started, I was like, kind of like worried, like, oh my gosh, am I taking on too much? And now that it ended, I can look back and I was like, you know what, that was actually a fun year and I learned a lot, and I left, even more inspired. So I'm excited for you.
And thank you, Omar, so much for everything that you provided this last year.
It's a team effort with the Medical Society. That's the beauty of it, But no, I'm excited. So I think that's the end of our podcast here. You can follow us on YouTube, Apple, Spotify, X. So everybody, please subscribe, and we'll see you on the next podcast.